Good day. Welcome to My Health Cebu. I'm your host, Dr. Steven Seno. The month of September brings a lot of awareness as we are trying to promote several diseases that need to come to the forefront of our focus as a community. So for this particular afternoon, we are very privileged to have with us our guests who are competent specialists in this particular field. So we're going to talk about epilepsy, and September being Epilepsy Awareness Month. So this afternoon I am happy that we have with us our two guests. The first is Dr. Janette de la Calzada. She is a child neurologist. She completed her medicine at the UP College of Medicine and then proceeded her residency training at the Philippine General Hospital, and as well as her fellowship. And then joining us this afternoon also is Dr. Josh Abejero, who also completed his medicine at the UP College of Medicine and then proceeded to take his neurology at the Philippine General Hospital. So Dr. Janette and Dr. Josh, good day and welcome to My Health Cebu.
Good afternoon, Dr. Seno.
Hi.
Thank you for having us today, and hello to our audience.
So I'm happy that we have this opportunity to talk about epilepsy because it is something that is fairly common, and despite the fact that it's been there for such a long period of time, there's still so many misconceptions about this. So we'll use this platform in order to educate our audience, and then hopefully after they're watching this program, they'll learn something valuable today. So let's talk about epilepsy. So tell our audience, maybe we can tell them what exactly is epilepsy. How is it different from, say, a seizure? Okay. So either Dr. Janette or Dr. Josh can pipe in.
Ladies first.
Ladies first.
Ladies
Sorry,
first.
Josh.
Okay.
I said ladies, not seniority.
Yes.
I'm just kidding. So let's talk about epilepsy. So what is epilepsy? Like what Dr. Seno mentioned, how is it different from seizure? So epilepsy is a condition that is defined when you have at least 2 unprovoked seizures. When you say unprovoked, it just happened. It's not because there's fever or there's an immediate recent trauma, hitting the head trauma, which caused the seizure. So kalit-kalit lang siya. And it has to be recurrent, so that means at least 2. And that will give you a definition of epilepsy. It already expanded. The definition of epilepsy now includes, even if you have one seizure, you have a seizure, but you have known etiology or known cause for that seizure. Say, for example, a person had a stroke, and so there's brain injury. A year later, develops a seizure, then it will be defined as epilepsy because there is a known cause. The stroke, the scarring in the brain will cause that seizure. So the other expanded definition of epilepsy will include reflex seizures. When you say reflex seizures, it's a seizure caused by a certain stimulus that always happens. Every time you have this stimulus, the seizure happens. So for example lang, every time there's a blinking of lights, you get a seizure. So yun yung tinatawag natin, reflex seizure. And that will also be defined as epilepsy.
Okay. So Dr. Del Calzada, Janet, thank you for that extensive and I think succinct, exact definition of epilepsy. And to remind our audience, the reason why Dr. Del Calzada and Dr. Josh Abejero are joining us today, they are both neurologists. So Dr. Del Calzada's practice is in child neurology, whereas Dr. Josh Abejero is in adult neurology. So just to make clear, so we have with us a very competent set of specialists today who's going to talk about epilepsy in the lifespan, as people may start having it in childhood, and if they're not treated, may continue to have it into adulthood. So, Dr. Josh, does the same definition apply to adults?
Yes, that's true, Dr. Seno. So actually, the definition of epilepsy encompasses not just a pediatric group, but also among adults. So it's applicable. The one that mentioned by Dr. Janette is something that is also defined for adults. So another misconception lang though that we say about seizures, about epilepsy is that seizures, just to clarify lang pala, Doc, that seizure is a symptom. It's more of a symptom. It's a manifestation, no? The epilepsy itself is what we call the disease already. So that's why we need to make sure to differentiate that, because sometimes they
use it interchangeably.
Exchange nila.
Right.
Yeah, interchangeably na. So at least they get to know that the seizures is a manifestation, and that's how we also define for adult population.
Okay. So again, we've started off with the definition of a seizure. So and then you've already touched on things which are very associated with seizures for some reason. Itong mga myths and misconceptions about them. So can we perhaps tackle a few? No, I've heard that, or in common practice, although I know that it is wrong, but I'd like to bring it up, that when a person starts to have seizure, you should put something in the mouth. So can we talk about that? Is that something that we should be doing? Okay.
There's actually a video that used to be run in certain commercial centers showing what to do.
Right.
And that included putting a depressor, no, a guard, a mouth guard during a seizure. So let's just go back to the seizure. The seizure can come in different forms, because remember, we're talking about the brain, and it has many functions and it has different parts. So the seizures can be varied. But the most common one is the generalized stiffening of the extremities, no? That can be interchanging with shaking, no? So that's the generalized tonic-clonic. So some people think because the person might bite his tongue, that's why they put something, no, to guard the tongue. That's why they put in something. So this shouldn't be, because number one, during a seizure, especially the generalized type, that person is not aware he's having a seizure. So naninigas siya ba? So everything is stiffening. And so it's very difficult to put in something in the mouth, right? Now, you might break a tooth, and because he's unconscious, he's not aware he's having a seizure, that tooth might be aspirated, and there you have another bigger problem. So we shouldn't put anything there to protect the tongue, because if the tongue is bitten, it's just bitten. Like any wound, it's going to heal. It's not gonna be bitten off like the whole tongue will be.
Right. Oo. Hindi naman matanggal yung buong tongue, di ba? So
exactly, it's a very strong muscle. Samad ra jud na siya.
It will heal.
And like a samad, it will heal.
And also the danger that kay ang common gadget that is being, or utensil to be specific, that is inserted in the mouth is the spoon. No? Or the finger.
Or your finger.
Right. No, I forgot about the finger. So
the finger, because
push the spoon, you can also push the tongue back, no, and in fact close the airway itself, no, so that causes even further complications. Instead of makaginawa ang pasyente with epilepsy, di na nun siya kaginhawa, gitok na siya from the inside, no. So that's one of the reasons why. Yes.
siya isod. If you put your finger, because many put their fingers kasi nga they're in panic mode.
Right.
They put their finger, your finger can be bitten off.
Right. So, dili lang one ang dunay sakit, duhan nay injured. Okay? By doing that. Okay? So, let's talk about another myth. No? So, one of the myths is that you can stop a seizure by holding them down, no, or restraining them. So, can you in fact do that, no, if you do have a seizure?
Doc, that would be difficult in the sense that once the seizures have started on the convulsions, it will definitely it won't stop until a certain time, a period of time, no. So that's why usually what we do, no, mag-instruct with me sa sa family members, no, whoever sees them na mag-seizures, that first of all, do not panic. So that's one thing, no, do not panic. And then at the same time, when they have convulsions, no, what they do is they try to, when the seizure is about to begin, they just place the patient in a comfortable place, in a safe place, no, something that is safe just in case that they fall, no, or they just lie the patient somewhere in a safe, and place a pillow at the back of the head, and just the most important actually is not stopping, no, holding the body of the patient while convulsing. The most important is actually timing, no, the duration of the seizure. So instead of holding the body, they need to look at their watch and time it, no, because if it's more than 5 minutes, then that's dangerous, and then that's the best time. Now after the seizure, once the seizure is done, no, you just have the patient lie down, and you can put the patient sideways just in case mag-vomit siya. No? So that's one thing. And then just wait for the patient to recover, no? And eventually they will. No? But the timing would be the most important actually, rather than holding back the patient.
Okay, yeah.
May I just add, as you've seen, Joshua mentioned the 5-minute because 95% of the time, 95% of the time, the seizure will really stop on its own in less than 5 minutes. So that's why it's just important to time. We pahigdaon ng pasyente, and you put him on the side where you can see the face. Kasi in kaso man musuka siya, that's why we put them on the side, because in case they vomit, they do not aspirate what they vomited, no. But it is really important to see the time. That means 95% of the time dili kinahanglan og tambal, because muhunong ra siya kiyaha. But when you reach 5, you have to bring him to the hospital, because you might need the tambal na to stop the seizure.
So that's good to know. So again, a seizure will stop in most cases up to 95% on its own. So what's important if you're witnessing this seizure is to time it. No, be aware of the time. So there are many ways to do that, I guess. No, if you don't have a watch available, siguro you can do the 1-1000, 2-1000, 3-1000. There are certain songs, no, that you know that there's a certain time limit, like say Lupang Hinirang is approximately 2 minutes. And if you sing it properly, no, you can say no, it's 2 Lupang Hinirang, so it's approximately 4. Okay? So ang importante is dili siya ma-exceed ng 5 minutes, because there's, as we lead into this last myth, na seizures can kill, or epilepsy can kill. No, so that's one of the myths surrounding it. So can we clarify that? No, yeah, we will bridge into that conversation about the 5 minutes. No, so can indeed our guest today, can indeed epilepsy or seizures kill per se? No, epilepsies per se.
So if the seizure is brief, diba? If the seizure is brief, para lang nag-breath hold si brain. There's no oxygen kasi passing through. So kadali lang siya, the brain will recover. The person will recover. So most of the time, they do. They really recover, no? I do have to say there are certain patients who have difficult to control na epilepsy. When we say difficult to control, these are the patients who are taking more than one anti-seizure medication to control. No? So pwedeng 2, can be even as many as 5, and yet they still have seizures. They have the risk for what we call the sudden death in epilepsy, especially the seizures are not controlled. So this subset of people do have a higher risk of dying from epilepsy, no, compared to the majority. But generally, if it's just one seizure or a few seizures, the brain can recover, the person can recover. So what we want is to prevent the brain from having more seizures, hence we have to treat them.
And let me add on also, Dr. Seno, about actually another aspect that we need to look at, aside from the prolonged seizures that Dr. Janette was mentioning, the possible injury as well that may happen when the patient has seizures. So that's why we call, there's also aside from the sudden the SUDEP, the term for that, another issue is the epilepsy related injuries. Okay, So that's one can also cause death for patients with epilepsy. So for example, I have patients who really love like maligo sa dagat pa. So sa high, the seizures are not controlled. So they swim around and most of them will drown.
Yes.
When, especially if the seizures are not controlled. So when they're having seizures, no, while maligo sa dagat, they can drown, no. Another issue is also driving, no. So if they're not if their seizures are not controlled and they're driving, no, there's really a possibility for them to get an accident. So that's another aspect that you need to look at, and that's why you really need to advise your patients about safety, no, especially when it comes to patients with epilepsy na uncontrolled.
So again, Dr. Janette, Dr. Josh, thank you for sharing that information and that quick briefer, on what epilepsy is and how does it present and what should we be doing, and then also talking about those myths. So as we come back, we're going to take a short break. We're going to talk more about this, including evaluation, management, and the lifestyle of a person with epilepsy. So come join us. Welcome back to My Health Cebu. I'm your host, Dr. Steven Seno. We are doing this program because we are trying to promote epilepsy awareness in this particular month. So my guests today are two very competent adult and child neurologists, Dr. Josh Abejero and Dr. Janette Calzada. Again, welcome back, Dr. Janette and Dr. Josh. So before we went to a break, we talked about epilepsy and what was it. So before we go into probably seeking medical treatment for it, let's talk about the different types. So, Dr. Janette, what are the different types of epilepsy? Because we've only been describing a motor form of epilepsy. Are there other types that we should be aware of?
Yeah, that's right. No, we just discussed earlier the most common form of seizure, which is the generalized tonic-clonic, meaning it involves the stiffening of the whole body as well as the extremities, alternating with the shaking form of seizure. But the seizure, like mentioned, can really come in different forms, no? So some will have a seizure that's called focal unaware, no? The seizures can really come in different forms because remember, we're talking about the brain, which is a complex organ and has many functions. So one type of seizure is what we call the absence, no? The blank stare. So, ang common na scenario would be the teacher would be complaining about this child because sige siyang daydream. Kaya blanco lang siya. And when you call out the name, he doesn't respond because he's actually having a seizure. Kung sige siyang blank stare, no? Okay, that's one form. There are many. So, the other forms would be the patient is aware he's having a seizure because it's just part of the body that's having the seizure. That's what we call the focal seizure. So, pwede lang one part of the body is shaking, like one arm or one leg. And then we also have what we call the spasms, no? The flexor spasms, which are more seen in the very young. So, not common in the adults yan. Yung flexor spasms, para siyang makurat gani. Kanang, remember the motor reflex? So, meron kang flexor and extension spasm, no? And they come in clusters. So, sa high, the mothers they're not aware that the patient is really having a seizure because they thought nakurat rajud ang bata. But actually, because it's persistent and repetitive, that's when they bring that to the doctor, and then that's how they know na. So, the others would have what we call the head drops, mga atonic type. So, loss of tone, pwedeng magyango-yango lang or magsigig takil po, no? Yan din. So there are really many more, no, na types of seizures, but this time will be not enough to discuss everything, but I think that's enough.
It begins with understanding that different parts of the brain have different functions. So whatever that seizure may be in that brain, that is how you're going to manifest. No, so if it's in the motor part of the brain, then the presentation is going to be motor. Tapos meron diba, there's also auditory presentations, visual presentations. So again, yes, or changes in behavior, no, can also be part of a seizure. So, which then leads us, no, into if you feel as though you have a seizure or you have epilepsy, where should you go and what would be part of that initial assessment to be able to get that diagnosis? So Dr. Josh was going to help us with this regard. So Josh, again, who should they see? And then what can be part of that initial assessment? What can they expect from that initial assessment?
So, Doc Steve, so what's important is actually first is the recognition of so that would come from the patient, no, or from the family member. So that's why your platform is really helpful for the public, no. Now, when they encounter or they are a bit suspicious that their loved ones or they have seizures, no, the best view really is to consult a doctor, no. Of course, the experts of this form of disease, no, epilepsy, no, are of course neurologists, no. So they are we neurologists are doctors of the brain, so we are really familiar when it comes to handling these kinds of diseases or disorders, no. So of course when we arrive at the clinic, no, of course the most important actually when we encounter our patients is really a good history taking, no. When we talk to them, no, we really need to be very detailed when it comes to talking about what they feel, no. So actually there's I usually have a template on how I ask my patients usually, no. First is do they have some sort of odd feelings, no, or sensations that they feel before having this attacks, no. And then if they're not aware of their attacks, no, we ask their significant others, no, or family, no, if how can they describe the appearance of the seizures, no. Then after that, I would ask the next part would be we ask, no, the duration of how long the seizures are getting, no. And then the last part would be what happens to the patient, no, after the seizures, no? So those are the three things, because diagnosing epilepsy is really history taking, a good history taking and physical exam. And then after that, no, if we think, then there are succeeding initial tests that we usually look at, no, are this the most common that we order actually is what we call an EEG, no? So it's a special test wherein we try to place some sort of
electrode
on the scalp, no,
right.
Some wires, electrode wires, no, on the head, no, on the scalp, no, and then we try to look at the brain activity or brain waves, no? And from there we see some abnormal appearances of those brain waves. Then that would help us say that it's a seizure, no, or it's an epilepsy. But the really important here is a good history taking and a physical exam, which experts are really important, not to assess the patient.
Okay. So I'd like to stress here, no, now again, there are different types of epilepsy, and then it's important for you to diagnose that properly for our audience if you have a family member who has epilepsy, because ang iya magong treatment dili magud sa siya dekahon, no? It's going to be very specific, no. Depends on the age group, it depends on the functionality of the patient, and also the type of epilepsy that you actually have. So let's maybe talk a little about that, no. So once you do get treated, can you go into remission, no, once you have epilepsy, Doc Josh? Is that something that they can look forward to?
Okay, so that depends, Doc Steve, no, what causes, or what we call the etiology, meaning what's the underlying cause of the seizure, the epilepsy, no. There are different causes, no. So for us adults, no, usually what we encounter are in the adult population, usually what we encounter are post-stroke seizures, no, or post-stroke epilepsy. So that is due to when they had a stroke, no, prior, or it could be a tumor, no, presenting as a seizure, no, so those are the things that we need to look at. So that's why it depends also what is the underlying cause. Now, I think Dr. Janette can answer for the pediatric population, but I think there's a difference actually for that.
Okay. I agree with Dr. Joshua, no, na you have to look at the underlying cause. So once we diagnose epilepsy in a patient, we also try to look for the etiology or the cause, because that is part of managing the patient in terms of what will be the life of this patient, no, after having been diagnosed with epilepsy. So if the cause, so that's why for children, for example, we really look into the birth and maternal history. Was there a history of delayed cry, mga ganon, or is there
was there a pregnancy? Was it a difficult
exactly,
delivery?
or did this patient undergo a severe infection like meningitis? Because even if they survive the meningitis, they can have scarring from the injury, from the meningitis, and that will cause the seizures later on. Kasi na-scar na si brain, so it can trigger. Some patients will also have, the cause would be because there is an abnormal tissue malformation of the brain. So what we call the brain malformations, and many of them will also present with seizures. So therefore, part of the investigation would be getting an imaging of the brain so that we can see whether there is an anatomic cause for the epilepsy. For many though, meron tayong tinatawag na unknown.
Yes.
Unknown cause. No? Meaning, wa kakibaw, or because we are also limited by the utilities that are available for us to investigate the cause of the epilepsy. So, but this is a normal child doing well in school, except they have lang the seizures. And probably, bottom line, there is just a gene that turned off, which released the seizures, no? So, but these are the patients, the normal development, nothing was seen on MRI. These are the patients who have the better chance of being controlled and becoming free from their seizures after a certain period of time. So, matagal jud ka ng the management or the maintaining the anti-seizure medication will really take some time, no? You have to maintain them for a certain number of years before we even try to challenge the patient if he will not develop seizure if we taper the medicine.
Okay. So if I can just briefly summarize, no? So what we've talking here is that when you do see the right doctor, certain tests are going to be performed, and then that's going to describe your illness better. And with a better described illness, including where it came from, you will have a better understanding, what the treatment is going to be, and as well as the parameters of possible recovery or possible remission. Okay, so what are the medications of epilepsy are readily available in our setting? Is this something that they can access readily, and are there common side effects that they should be looking out for when it comes to these kinds of medications? So, Dr. Josh, maybe you can start us off with the adult population.
So, the drugs for what we call anti-seizure medications are widely available already now here in the Philippines. No, there are a lot of different types of anti-seizure medications that are available, and we choose a certain, for us doctors, what we do is, depends on the type of seizure, there are like certain medications that are best for that, for this type of seizure. So that's why we select that. That's because the likelihood is that it can control that type of seizure. So that's one thing that we need to look at. Another is also of course, it depends also on the characteristic of the patient. So another thing that we ask when we give anti-seizure medication is what there are other illnesses the patient has, comorbids, because certain medications can actually cause some sort of side effects, changes in the metabolic metabolic parameters or metabolic conditions sa patient, especially the elderly. So also another issue, especially in us adults, ng mga elderly na mag-seizure, they have a lot of medications to drink as well. So So what we do is actually we take into account, will the anti-seizure medication that we give will interact with the other medications that they're taking? So that's another And last, I usually also ask, can the patient afford the medication? That is always an important question, because Doc Steve, the issue here actually, epilepsy can be controlled. It's just that we need the compliance, and compliance requires the patient to take medication every day, So that's one thing. That's why when I see patients, I always ask, what's your job? How much can you afford? Because that would be very important actually when it comes to controlling seizures.
That's right. So,
Yeah, I agree.
in the pediatric population, Doc Janet, I guess they have different, no? Because wala, not so much lifestyle diseases yet, no? Such as, like, say, heart disease or hypercholesteremia. In the pediatric population, what concerns do the parents have?
Mothers always ask that. The parents always ask that. Sometimes they even visit the neurologist to make sure if the child, if let's say develops an infection, if he can take that antibiotic,
Right.
no? So, but in terms of, kasi we're talking about maintenance medications, very few children lang naman have maintenance at a very young age.
Right.
So, we don't really have that problem of interaction, prolonged interaction with our patients, no? I mean, our children are not really taking birth control pills,
Right.
anti-hypertensive.
Right. Lipitor.
But I do agree with Dr. Abejero, no? Those things that he mentioned about deciding on what medication is best for the patient. And so I'll just go back again to the importance of the EEG. Kasi that also helps us. When we do the EEG, it helps, we're looking at patterns of the seizures that will help us decide also what medication is best for this patient. So it's not really a decajon thing na epilepsy, kani ang tambal.
Right.
We look into many factors on choosing the tambal that is best for that patient. It also includes on the tolerability of the patient, no? And then, for example, no, for children, there are certain drugs that lalo na kung payat ang pasyente, there are medications that have a possible side effect of them losing weight, and the mothers really do not like that.
Right.
Eh kung payat na siya daan, 'di ba? And then there's that risk. There are other medications naman that
And
can
given as an alternative. Right.
give them weight, have a good side effect of gaining weight.
Right.
So kaya sometimes you have to weigh all the factors for you to decide which medication is best.
Right.
Kaya it's not decajon, it's always tailored to the kind of patient that you have.
So, very, very good insight, no, from Dr. Abejero and Dr. Del Calzada. So we're going to take another break, and as we come back, we're going to talk about this a little further, and also the lifestyle, no, that we want to promote in individuals, no, who have epilepsy. So come join us. Welcome back to My Health Cebu. I'm your host, Dr. Steven Seno. You're joining us in a very interesting conversation on epilepsy awareness with my guest, Dr. Janette Del Calzada, a child neurologist, and Dr. Josh Abejero, adult neurology. So, Dr. Janette, Dr. Josh, before we went into a break, we were talking about tailoring the management for individuals with epilepsy because they will have different parameters, no? They cannot be decajon, and then also, as this is a chronic illness, you must have that therapeutic alliance. So trust your doctors, at the same time be open with them about your concerns, and if you have any apprehensions about any part of the treatment or management. So this particular segment, let's talk about having a full life, no, with epilepsy. So one of the things that we want to promote here during epilepsy awareness is there should be no stigma, no, there should be no limitations to a life with epilepsy that is well managed. Okay, so let's talk about that. So let's start off with Dr. Del Calzada. No? So what are your concerns? What are the parents' concerns when they bring their child to you with epilepsy with regards to limitations and the lifestyle that they can probably have as children, okay, and adolescents?
Right. So many are concerned if they can even go to school,
Right.
if they can have their children go to school, play, no, do the regular stuff that any normal child should be doing. And my answer is yes to all. You can really send your child to school, do activities, no? Let me mention a few names that everyone is familiar with. Joan of Arc, Napoleon Bonaparte, Vincent van Gogh. Big people in history, they all had epilepsy, and yet they became big people in history, right?
Right.
So we can also do that for our child. We always want to maximize the potential of each child. So let them go to school, do their activities. Ang important lang naman is we have the epilepsy under control for them to go to do all these things, no? Right? But although there are certain activities, extracurricular activities that we will avoid, no? So, we will avoid boxing kasi contact sport niya, you know, you always hit the head and there's possible traumatic brain injury there. Or horseback riding, especially kasi because you're moving and you might fall when you have a seizure.
Right.
The key really is seizure control.
Right.
If the patient has seizure control, he can really do all this potential stuff in his lifetime.
Ang dagdag ko lang dyan, Doc Janet, is kanang the sport of taekwondo. No? So taekwondo is a great sport. So in the past, the Philippines in the Olympics has had medals from doing that sport. However, understand that in taekwondo, diba, there's a scoring system. So if you hit the back of the head, that's 3 points. If you hit the front of the head, it's 2 points. If you hit the chest or the back, it's only 1 point. So as soon as they start sparring, which is at a certain level of a belt, no, after yellow ata, nagsa-start na sila mag-spar, the objective is really to hit the head. So despite the protection, I don't think it's adequate. So I probably would include that in your list, no, taekwondo.
Yeah.
Okay.
Ano yan relative daw. I didn't mention it outright, pero basta any contact sport
That has to do
that
with the
will
head.
really,
Kasama na
hit
yung
the head
diving,
potentially.
kasama na siguro yung rock climbing kasi may possibility of falling and hitting your head.
Yeah.
Okay.
Na mga extreme sports
Gymnastics,
naman yan. They can really do basketball, soccer naman ng konti.
Running.
Not very competitive, di ba? Running.
Yes, yeah.
Di ba?
Okay. So again, no, just because a child has epilepsy, you automatically limit, no, yung potential. In fact, you explore other potentials and then promote that, no, including good grades in school, no, scholastic achievement. Because if managed naman yung epilepsy, you can have that. Because one of the myths that I read initially about epilepsy is that when you have epilepsy, automatically may intellectual or learning disability, which of course is not the case, no, Doc Janet? Yes.
I have a patient who has epilepsy and is now a medical student and is doing well in school.
Yes. Well, I am sure, no, we have colleagues, no, in the medical field and other good fields, no, who've had epilepsy and then are now currently in remission. Okay.
Agree.
So let's now segue to Doc Josh, no. The adult experience is different, no, kasi out of school into the workplace. So, ano yung parameters dyan as an adult neurologist? What do you advise your patients?
So actually, the common thing that they always ask with us is actually, can they work? No? So yes, definitely they can work. No, because our goal actually for our patients is they become productive, no, and they don't become like what do you call this? Murag ano ba? Magluoy sa ilahang murag mag self ano sila ba? Self-pity, that's the term, no? That they have an epilepsy, they can't work, no? So, I always advise them, yes, you can work, no? Definitely can work. But there are only certain things that they are not, we try to advise not for them not to get that kind of job, no? So, for example, one is like driving. So, if something is involved with driving, no? Especially like truck driving, of course, that would something be dangerous, especially if the seizures is still there, no? Because that would actually cause harm, not just with himself, but also with others, no?
People around him, right?
Another is anything that is machine operating, no? Mga machine operated na mga work, no? Like for example, when they're operating a crane or unsa, no? Of course, that would be something. So, but other than other jobs na pwede man yun sila magtrabaho, no? But basta ang goal lang yun, same as what Dr. Janette mentioned, no? The important here is actually a controlled seizure or epilepsy. That's why your partner, your friendly neurologist are your partner there when it comes to controlling, no, their illness, no, the goal there. So that yun na, we're working together yun na with the patient.
So what other lifestyle recommendations, no, would you advise a person who is currently living with epilepsy? So are there certain activities, no, that can probably promote wellness for a person with epilepsy?
You know what? Sorry.
Go ahead.
May I?
Yes, of course.
Yes, sure.
Diba? So, they have to understand what can trigger a seizure. They have epilepsy, but there are certain triggers that can trigger the seizure, such as sleep deprivation. kuwang sa tug and stress, no? So if you avoid sleep, limitation, and stress, you know, you're in better shape not to get your seizures, right? So other forms that can help you become more relaxed is doing yoga. Yung mga yoga or mga biofeedback, meditation.
Mindfulness.
Because you also, kasi you also bring out the good hormones that make you relax and not be stressed. Therefore, you can also decrease the chance of having seizures. That's one lifestyle you can do.
So again, kasama din yan sa yung appropriate pursuits of exercise and regular forms of it.
Yeah.
Okay.
Yes.
Right.
Yes, I agree.
And then, Josh, same recommendations for the adult, or meron pang more extended than that?
Other thing also is actually trying to avoid na makakuha infection. No? So if they really need to like for example, if they have vaccines that they need to take, especially karon because of the pandemic, they really need to take COVID-19 vaccine. So that's one thing, no, they need to take it. Why? Because even just a simple cough, cold, fever, no, for a patient with epilepsy, that would actually decrease their threshold to have what we call a breakthrough seizure. So that's a term, no. So na-tendency yun sila na if just a simple fever lang, mag-attack yun sila tana. No? So, that's why we always advise our patient na if you feel ill, no, make sure always to consult your doctor. That's one thing. And also, try to stay healthy because if your lifestyle is not healthy, of course, definitely makakos na og the problem. Another is the vices. So there's especially among mga adult and even yung mga young adults na to, no, the alcohol and smoking. So that's one thing. So I always advise my patients to avoid alcohol and smoking. No, alcohol it also decreases the possibility. It also increases the possibility of another breakthrough seizure. No? For smoking naman, the problem is that smoking actually has an interaction when it comes to your anti-seizure medications. There's a probability that it decreases the effectivity of the drug. No, so ana siya. So that's why always advise your patients to have a healthy lifestyle. No. If they really if they want to enjoy like occasional drinking, yes, they can, but not to a point na maghubog yun sila. No, that's one thing. So, maybe just one glass of wine would be fine, but otherwise, no, as much as possible, try to avoid vices here.
So everything in moderation, no, okay, as much as possible. So we've been talking about caring for epilepsy as an individual. No, I guess part of that lifestyle also be surrounding yourself with a community of people who support you, no, who once you have your epilepsy. So for those among you who are listening, we advocate that you spread the word about epilepsy and how you can identify it, where to get your treatment, and how to promote a lifestyle that is healthy, that will support remission for epilepsy. So we're now down to our last few minutes of our program. And in this particular part, we would like to give a few minutes to our guests to address the audience in order to summarize or to give you some parting reminders before we end the show. So I will start off with our child neurologist, Dr. Janette. Can you lead us into our final reminders for our audience?
I'll make it short.
Yes.
Epilepsy can be controlled with the right medication and the right lifestyle. And remember, the disease does not own you, but you own the disease. So that means you can control your disease. Thank you.
Right. Thank you. Doc Josh, your words?
Yeah. So same as what Dr. Janette mentioned. No? So epilepsy is not a death sentence. No? It's something that can be managed, no? Especially because you just need to consult your doctor about it, no? You can talk about the issues that you can with us doctors, no? What your issues are when it comes to not just with the medication but in general, no? So that's one thing because epilepsy, you can live a normal life, basta controlled lang yun, no?
Okay, so that is a good way to summarize the program. No, it's on a positive note. So we're telling you that epilepsy is out there. It is something that you can live with, and it can be managed in our setting. So in behalf of Dr. Abejero, Dr. Del Calzada, who is joining us today, promoting epilepsy awareness for the month of September, I would like to thank everybody for joining us, and I hope that you learned something valuable today. And then do spread the word. If you know of somebody who has it, or you think that somebody might have it, start your step in their journey of wellness, and hopefully get into that remission phase that you want to achieve, and as well as continue to have a life that is full and rich. So again, in behalf of our staff here at My Health Cebu, I'd like to thank you for joining us, and Cebu, stay healthy.